Can we start by talking about how you became a doctor and how you became a spinal neurosurgeon?
I think in the middle of high school, or maybe a little later, I thought I would be a physician. My dad was a dentist. My grandfather was an ear, nose, and throat doctor. My uncle was an ear, nose, and throat doctor. So medicine's kind of been in our family, although in our immediate family, nobody is a doctor. But I thought in the middle of my high school days, I would probably go to medicine. And during college days, I was kind of a Renaissance man, I guess you want to say, and I majored in philosophy. After 2 years of major philosophy, my counselor says if I major in philosophy, I'll never get into med school. So I switched to chemistry and finished up majoring in chemistry and finished up at Arizona State University, and then was fortunate enough to get into medical school at the University of Arizona. Did my 4 years there, and then 1 year of internship. In those days, you could do your internship in a place not necessarily where you do your neurosurgical residency. Probably in my third year, I decided I would go through the neurosurgical route. I had the character, I guess, personality of a surgeon, but I wanted and I loved neurology. So obviously the combination of which leaned me toward neurosurgery. So my internship year, I was fortunate enough to apply and obtain a position at Tufts New England Medical Center, where I did my residency in neurosurgery for 6 years. Finished there in 1977, got married in 1974, and then we moved to Ohio. My wife did not like that very much, and we had Alyssa, our firstborn, in Ohio, and then when she was 2 weeks old, we moved to Phoenix. And I've been in Phoenix ever since 1978. I was a general neurosurgeon from 78 till 83. In 1983, we formed a group called the Bureau of Brain and Spine. I was initially of 8 neurosurgeons. After much discussion of about a year, we opened up our doors of October 1983. Robert Spetzler was the chair, I was the vice chair. We all did general neurosurgery, I think, for several years. And then it dawned on us, how could we be the neurosurgeon's neurosurgeon? And we decided to subspecialize because I had more interest in spine than anyone else of the group of 8. I specialized in spine. So starting in the 1980s, late 80s, 1990s, I dedicated my neurosurgical practice to spine. At the same time, the organized orthopedic was granted a fellowship by the Accredited Council of Continuous Medical Education, ACGME, that they would have a fellowship in spine under the controls of ACGME. This raised alarm among organized neurosurgery because we thought we would lose spine totally to orthopedic colleagues. Neurosurgeon in those days did primarily the decompression, and then the orthopods came in if they need to and do the fusion and instrumentation. Consequently, a spine task force was formed. I was vice chairman of that, a national task force. And we set out what a neurosurgical program needs to have to train residents to be experts in spine surgery, in neurosurgery. And consequently, with some turf battles, including my turf battle in the late 80s and 90s with our orthopedic colleagues, after 4 years of that turf battle, I was granted by the Medical Executive Committee a complete care of spine, from instrumentation from the occiput to the sacrum, and doing decompression, fusion, and instrumentation. That changed neurosurgery. I was in a leadership position at that time in neurosurgery, being the incoming president of the Joint Section, as well as on the Executive Committee of the Congress. And consequently, we began training neurosurgical residents in spine, including instrumentation. I also started a fellowship starting in 1988 initially had 1 fellow year and then 2 a year, and of course they trained in spine. Presently, neurosurgery is very much of a heavy hitter in spine. The average neurosurgeon dedicates 80% of his or her time treating patients with spinal disorder. So we are very much a player now. We do deformity, we do every aspect of spinal disorder is now being done by neurosurgeons as well as our orthopedic colleagues. We have buried our access as far as the feud with the orthopedics, and for the last, I would say, 10 to 20 years, we have become colleagues trying to do the best we can with patients with spinal disorders. So neurosurgery is a very big, heavy player in treating patients with spinal disorders.
So when did you first start performing spinal surgery, and how would you describe the attitude of the wider faculty towards spinal surgery at that time?
Well, initially, as I alluded to earlier, spine was the weak sister in neurosurgery. The star players were those neurosurgeons that did the vascular neurosurgery, the complex tumor neurosurgery, the functional neurosurgery, and spine, because we only did decompression without any other amatorium that we could treat spinal disorders, we were indeed the weak sister. That changed totally in the late 80s and early 90s in my institution here at the Neurological Institute, and eventually nationally. Now instrumentation is now part of the definition of neurosurgery by the American Board of Neurological Surgeons, that they changed instrumentation and fusion as part of a neurosurgeon's definition. So that changed in about the late 80s and early 90s. And now spine is very much the major component of every practicing neurosurgeon, being academic or in private practice in the United States.
So from your perspective, how would you describe spinal surgery has changed in terms of its greater popularity over the last half a century?
It's tremendously changed. It's unbelievable changed. When I first started doing instrumentation, there were no instruments or tools to, for example, bend the rods or to accommodate the patient's anatomy. In fact, just recently, the operating room nurse says if I wanted my anvil back, because I used an anvil, which I bought at Sears, and which you can see behind me, which I put rods in to bend it with the pliers. And that was the beginning. That was I did in the late 80s. And just think where we are now with over the last 2 decades in spinal neurosurgery. We now use robots. We use minimal invasive spine surgery. It is just totally changed. For example, instead of a large incision for deformity, we have multiple small incision guided by image guidance to place the instrumentation and also to do the tumor removal or decompression or infectional abscess removal. So now we have changed from barbaric incision, if you will, to minimal invasive spine surgery, guided by robots, guided by computerized, guided by image guidance. We also monitor the spinal cord during our operations with continuous what we call motor vocal potentials as well as somatosensory potentials. Right now, the typical operating room for spinal neurosurgery, it looks more like a space capsule, if you will, with computers, robots, image, MRI scans intraoperatively, CT scan intraoperatively, live feedback with fluoroscopy. It has changed, so instead of just going in and doing decompression, which we did in the 70s and 80s, we now, with very sophisticated machinery, instrumentation, we hopefully do our patients good by not making these huge incisions, small incisions, less pain, less operating time, less hospital stay. So it has, spinal neurosurgery has changed tremendously from basically neurosurgeons doing very minimal spine to it's now the major component and having all these modern techniques, modern procedures that has evolved over the last 20 years.